Question 1. A nurse is caring for a patient newly diagnosed with acute hepatitis B. Which intervention is the most appropriate to prevent transmission? A. Place the patient in airborne isolation. B. Encourage the patient to increase oral fluids. C. Use standard precautions during patient care. D. Administer antibiotics as ordered. Answer. C. Use standard precautions during patient care. Question 2. Which patient should the nurse assess first in a hepatitis B care unit? A. A patient with fatigue and jaundice. B. A patient with confusion and hysterexis. C. A patient requesting medication for nausea. D. A patient reporting anorexia. Answer. B. A patient with confusion and hysterexis. Question 3. A nurse is assigning care to a licensed practical nurse, LPN, for a hepatitis B patient. Which task is most appropriate to delegate? A. Initial patient admission assessment. B. Administering for immunoglobulin. C. Reinforcing education on hand hygiene. D. Creating a discharge plan. Answer. C. Reinforcing education on hand hygiene. Question 4. A nurse is educating a patient with chronic hepatitis B. Which statement indicates a need for further teaching? A. I should avoid alcohol to protect my liver. B. I must take all medications as prescribed. C. I can donate blood after I'm feeling better. D. I need regular follow-up appointments. Answer. C. I can donate blood after I'm feeling better. Question 5. The nurse is reviewing lab results of a hepatitis B patient. Which finding requires immediate intervention? A. Elevated ALT and AST. B. Positive HBsAg for more than 6 months. C. INR of 2.8. D. Bilirubin level of 1.5 milligrams per deciliter. Answer. C. INR of 2.8. Question 6. A nurse is planning care for a client with acute hepatitis B. What is the priority nursing diagnosis? A. Risk for infection. B. Impaired comfort. C. Imbalanced nutrition, less than body requirements. D. Fatigue. Answer. C. Imbalanced nutrition, less than body requirements. Question 7. The nurse is caring for multiple clients. Who is at highest risk for developing chronic hepatitis B? A 45-year-old female with no history of liver disease. B. A newborn whose mother is hepatitis B surface antigen positive. C. A 30-year-old vaccinated healthcare worker. D. A 16-year-old recently exposed to the virus. Answer. B. A newborn whose mother is hepatitis B surface antigen positive. Question 8. Which task should the RN not delegate to the unlicensed assistive personnel, UAP, when caring for a patient with hepatitis B? A. Assisting the patient with ambulation. B. Measuring oral intake and output. C. Performing a focused abdominal assessment. D. Assisting with hygiene and bed change. Answer. C. Performing a focused abdominal assessment. Question 9. Which precautions should the nurse implement when administering an injection to a hepatitis B patient? A. Wear a surgical mask. B. Wear a gown and goggles. C. Wear gloves and dispose of the needle in a sharps container. D. Use sterile technique for all injections. Answer. C. Wear gloves and dispose of the needle in a sharps container. Question 10. A nurse is caring for a patient with liver failure due to chronic hepatitis B. Which provider order should the nurse question? A. Administer lactulose. B. Low-protein diet. C. Acetaminophen 650 milligrams every 4 hours, PRN. D. Monitor neurological status every shift. Answer. C. Acetaminophen 650 milligrams every 4 hours, PRN. Question 11. A patient with chronic hepatitis B is being discharged. What is the most important instruction to give? A. You can stop medication if symptoms resolve. B. Avoid sharing razors or toothbrushes with others. C. Limit fluid intake to reduce liver workload. D. You can resume strenuous exercise immediately. Answer: B. Avoid sharing razors or toothbrushes with others. Question 12. During handoff, which information is most critical for the nurse to communicate to the next shift about a hepatitis B patient? A. Patient's favorite food. B. The visitor schedule. C. Status of liver function tests. D. Sleep pattern during the day. Answer: C. Status of liver function tests. Question 13. A nurse is teaching a newly diagnosed hepatitis B patient about disease transmission. Which statement indicates proper understanding? A. I can share needles if they are cleaned first. B. The virus is transmitted through contaminated food. C. I must avoid unprotected sex. D. The disease can spread by coughing. Answer: C. I must avoid unprotected sex. Question 14. Which staff member should be assigned to care for a client with active hepatitis B? A. A pregnant nurse in her first trimester. B. A nurse who is vaccinated against hepatitis B. C. A nurse recovering from influenza. D. A student nurse unfamiliar with infection precautions. Answer: B. A nurse who is vaccinated against hepatitis B. Question 15. The nurse notes a patient with hepatitis B has yellow scara, ascites, and altered mental status. What should the nurse do first? A. Document the findings. B. Notify the healthcare provider immediately. C. Reassure the patient and family. D. Administer a sedative. Answer: B. Notify the healthcare provider immediately. Question 16. A nurse is preparing to administer the hepatitis B vaccine to a newborn. Which action is a priority? A. Ensure the infant is at least 1 week old. B. Check the mother's hepatitis B status. C. Administer orally with food. D. Delay the vaccine if the infant cries. Answer: B. Check the mother's hepatitis B status. Question 17. What is the best way to evaluate the effectiveness of hepatitis B vaccination in a healthcare worker? A. Assess for absence of symptoms. B. Verify negative HbC levels. C. Measure hepatitis B surface antibody titers. D. Monitor liver enzyme levels. Answer: C. Measure hepatitis B surface antibody titers. Question 18. A hepatitis B patient with severe fatigue is refusing to ambulate. What is the best nursing intervention? A. Insist on immediate ambulation. B. Document and skip ambulation for the day. C. Educate the patient about the benefits of gradual activity. D. Administer an energy supplement. Answer: C. Educate the patient about the benefits of gradual activity. Question 19. A nurse is administering post-exposure prophylaxis for hepatitis B. What should be given to an unvaccinated patient after needle stick exposure? A. Hepatitis B vaccine only. B. HBIG and initiate hepatitis B vaccine series. C. Oral antivirals. D. No treatment if asymptomatic. Answer: B. HBIG and initiate hepatitis B vaccine series. Question 20. A patient with chronic hepatitis B reports dark urine and right upper quadrant pain. What is the nurse's priority action? A. Encourage rest and oral fluids. B. Notify the healthcare provider. C. Offer acetaminophen for pain. D. Provide reassurance. Answer: B. Notify the healthcare provider. Question 21. Which lab result in a hepatitis B patient requires the nurse to take immediate action? A. HBsAg positive. B. Alta 50U/L. C. Serum ammonia level of 110 micrograms per deciliter. D. Albumin level of 3.5 g/dl. Answer. C. Serum ammonia level of 110 micrograms per deciliter. Question 22. Which nursing action is most appropriate when administering hepatitis B immunoglobulin (HBIG) to an infant born to an infected mother? A. Administer HBIG intradermally. B. Mix HBIG with a hepatitis B vaccine. C. Give HBIG within 12 hours of birth. D. Delay HBIG until 1 week of age. Answer. C. Give HBIG within 12 hours of birth. Question 23. A nurse is caring for a hepatitis B patient with pruritus. What intervention is most appropriate? A. Apply alcohol-based lotion to the skin. B. Keep the patient in a warm environment. C. Use mild soaps and keep fingernails short. D. Restrict fluid intake. Answer. C. Use mild soaps and keep fingernails short. Question 24. The nurse teaches a patient with hepatitis B about dietary modifications. Which food should be avoided? A. Lean chicken breast. B. Fresh fruits. C. Grilled salmon. D. Fried bacon. Answer. D. Fried bacon. Question 25. Which symptom in a patient with hepatitis B should the nurse report to the healthcare provider immediately? A. Mild nausea. B. Clay-colored stools. C. Decreased appetite. D. Low-grade fever. Answer. B. Clay-colored stools. Question 26. Which patient can be safely assigned to a nurse caring for an immunocompromised client? A. A patient recovering from acute hepatitis B. B. A patient with open tuberculosis. C. A patient with suspected meningitis. D. A patient on airborne precautions. Answer. A. A patient recovering from acute hepatitis B. Question 27. A patient with hepatitis B asks how the virus is transmitted. Which is the best response by the nurse? A. It spreads through mosquito bites. B. It can be transmitted via blood and body fluids. C. It is transmitted through contaminated water. D. It spreads through coughing and sneezing. Answer. B. It can be transmitted via blood and body fluids. Question 28. A patient with chronic hepatitis B is scheduled for a liver biopsy. What is the nurse's priority post-procedure? A. Monitor intake and output. B. Keep the patient NPO for 24 hours. C. Place the patient on the right side. D. Elevate the head of the bed. Answer. C. Place the patient on the right side. Question 29. Which symptom suggests worsening hepatic encephalopathy in a hepatitis B patient? A. Bruising on arms. B. Constipation. C. Musty breath odor. D. Elevated hemoglobin. Answer. C. Musty breath odor. Question 30. The nurse prepares to administer the first dose of hepatitis B vaccine to a child. What should the nurse verify first? A. Child has received acetaminophen. B. Parental consent is obtained. C. Child has eaten breakfast. D. Insurance coverage is confirmed. Answer. B. Parental consent is obtained. Question 31. A hepatitis B patient is confused and agitated. What is the nurse's first priority? A. Administer a sedative. B. Apply soft restraints. C. Maintain a safe environment. D. Reorient the patient hourly. Answer. C. Maintain a safe environment. Question 32. A nurse is preparing discharge instructions for a patient with hepatitis B. Which activity should the nurse advise against? A. Using separate utensils. B. Engaging in sexual activity without protection. C. Attending follow-up appointments. D. Washing hands frequently. Answer. B. Engaging in sexual activity without protection. Question 33. Which of the following patients is most appropriate for cohorting with a hepatitis B positive client? A. A patient with active herpes zoster. B. A patient with hepatitis B. C. A patient with suspected C. difficile. D. A patient with neutropenia. Answer: B. A patient with hepatitis B. Question 34. Which nursing action is a priority when administering hepatitis B vaccine to an adult? A. Use the Z-Track method. B. Confirm the vaccine is oral. C. Administer in the deltoid muscle. D. Check blood glucose before giving. Answer: C. Administer in the deltoid muscle. Question 35. Which finding is most concerning in a pregnant woman with chronic hepatitis B? A. Weight gain of 3 pounds in a week. B. Mild fatigue. C. HbAg positivity. D. Increased fetal movement. Answer: C. HbAg positivity. Question 36. A patient asks how long hepatitis B can survive on surfaces. What is the correct response? A. Less than 1 hour. B. Up to 7 days. C. Only while wet. D. It does not survive outside the body. Answer: B. Up to 7 days. Question 37. A nurse receives a needle stick injury from a patient with unknown status. What is the nurse's priority action? A. Document the incident. B. Wash the area with soap and water. C. Notify the supervisor at the end of shift. D. Call the patient's family. Answer: B. Wash the area with soap and water. Question 38. A nurse is educating a patient with chronic hepatitis B. Which lifestyle change is most beneficial? A. Start a high-protein diet. B. Begin a weightlifting routine. C. Stop alcohol consumption. D. Increase intake of fatty foods. Answer: C. Stop alcohol consumption. Question 39. What is the best nursing rationale for avoiding acetaminophen in a hepatitis B patient? A. It increases insulin resistance. B. It can damage hepatic cells further. C. It causes fluid retention. D. It decreases vitamin absorption. Answer: B. It can damage hepatic cells further. Question 40. A nurse is reinforcing education to a caregiver of a hepatitis B patient. Which statement requires correction? A. I should wear gloves when handling blood-soiled items. B. I will clean surfaces with a bleach solution. C. I can share personal items if they look clean. D. I will ensure all needles are disposed of safely. Answer: C. I can share personal items if they look clean. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!